Hello people, in this video we want to look at thyroglossal duct cyst. Basically this is a neck mass, okay, and it is a midline mass. Let's try to understand what is thyro, something to do with thyroid gland, glossal, something to do with tongue, some duct is there, over that some cyst has developed, okay. So let's try to understand this. Basically in development what happens, the thyroid will be here, up higher up, and then it descends down, okay. So the thyroid gland has descended and this is coming from where? From behind the tongue, right? So this is a thyroglossal. So here you have the thyroid, here you have the glossal, thyroglossal, there's a duct here, okay. So this duct, right, on this duct there is a cyst formation which moves up and down when they protrude the tongue, okay. So when they protrude the tongue, that time it moves up and down. So you will ask the person to just stick their tongue out, and as they stick their tongue out, in and out, the thyroglossal duct cyst will move, okay. So basically, did you understand? Thyroid, tongue, there's a duct between these two, there is a cyst on this duct, cyst is fluid filled, right? So this is a midline mass, neck mass, okay. So basically what is this? It presents as a cystic midline swelling, usually affecting young children, but it can occur at any age. It is usually rounded, okay, it is rounded. It increases in size with upper respiratory tract infection. So whenever there is infection, let us say this person has an upper respiratory tract infection, right? So that time what can happen? It can, this duct cyst can increase in size. Okay, so it increases in size with any respiratory tract infection. That's another point you have to know. Sometimes it presents as a draining sinus if it has burst due to infection. So it can burst out and release pus. So it can be a draining sinus, okay. Or you will have to surgically drain the cyst. You can surgically drain it. Because of the attachment of the thyroglossal duct to the foramen cecum at the base of tongue, it moves with trunk protrusion. So why does it move when the tongue is protruded? Because it is connected to the foramen cecum, which is there at the base of the tongue. So if this is the tongue and here they are showing you the foramen cecum, okay. So this is your tongue and where the foramen cecum is, from there to the thyroid, there is a thyroglossal duct, right? So when you move this tongue, the cyst will move, okay. Then thyroglossal duct cyst. So we saw this during development. The thyroid anlage starts at the foramen cecum, passes through the base of tongue and then descends in front, behind or through the hyoid bone. So it's going through the hyoid bone. Let us look at this photo here. So hyoid bone is here, foramen cecum is here. So where is the thyroglossal cyst? 1 to 5. So this is the thyroid gland. So this is the duct, looks like, right? This is the duct. So from foramen cecum to thyroid gland, you have a duct. So anywhere along this duct, there can be the cyst. So cyst can be in any one of these positions. Here it can be, 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 okay. Basically understand the position of the hyoid bone here. That's what they're saying, right? So it can, see here's the hyoid bone. So what they're saying here, how this starts, it starts at the foramen cecum, passes through the base of tongue and then descends in front, behind and or through the hyoid bone. It can go either in front of the hyoid bone, behind the hyoid bone or through the hyoid bone to form the thyroid gland. Okay, so this it will go and form the thyroid gland. Which will form the thyroid gland? This thyroid anlage. Actually, what is this anlage? Do you know what it is? Basically, it is some endodermal cells. That's it. Okay, so it has to go and form the thyroid, right? So it will go by how? From the foramen cecum, it will pass through the base of tongue and then it will go near the hyoid bone, behind, front, through it or what. And the thyroglossal cyst can occur anywhere in the course of this thyroid duct. Are they calling this thyroid duct? Thyroglossal duct actually it should be, right? The cyst, right guys, what they're saying here, see here, the cyst can be, see it's here, 5 is the closest. But here what they're saying, this cyst can contain even the only functioning thyroid tissue. It can only contain, at sometimes it can contain the only functioning thyroid tissue in the body. So you should be very careful while removing the cyst, right? Rarely carcinoma also can develop in the cyst. Now the cyst was only having infection and it was draining and it was giving some cosmetic defect. Okay, fine. But now this carcinoma also can develop. Rarely. So we will just go with rarely it can develop in this. Okay, rarely. CT MRI next should always be done to find the orthotopic thyroid gland. So you should know where the thyroid gland position is, right? So you should always do CT MRI neck. Okay. So it is to find the normal position of thyroid gland in this person. You have to do MRI neck CT. Okay. So what did you understand so far, guys? So this is the wherever the in these 5 locations it can be there, the thyroid cyst, thyroglossal cyst. Okay, and it can even contain the only functioning thyroid tissue, so you should be careful. So you should do neck CT or MRI to find the orthotopic position of the normal thyroid gland, right? And rarely carcinoma can develop in this person. Moving on, guys, to you can also do indirect laryngoscopy. So you can, when you're doing examination of oropharynx, right? When you're checking the base of tongue and vallecula, you can also check this for thyroglossal cyst. You can check. Okay. So indirect laryngoscopy, look for the color of the mucosa, prominent veins, varicosities. Basically, laryngoscopy, they're telling you what and all you can look for when you're doing examination. In that, you can also look for a cystic swelling, which can indicate a thyroglossal cyst. Or it could be other things. It could be a vallecular cyst, dermoid cyst. It could be a thyroglossal cyst. It could be any of these, right? When you do this. See, also remember one of the differential can be lingual thyroid, okay? So it can be a lingual thyroid also. Another differential is lingual thyroid. What is lingual thyroid? Basically, it is abnormal mass of ectopic thyroid tissue seen at the base of tongue. But this can be the only functioning thyroid tissue also. Even that is possible, okay? Guys, now some patient comes to you, midline mass is there, neck mass. It can be so many other things, okay? Don't think only that. It can be, what and all can it be? See here they have written thyroglossal duct cyst. But it can be submental lymph node, dermoid, Ludwig's angina. Ludwig's angina, you know, right? Infection of the submandibular space. Then aberrant thyroid. Okay, something they're blaming on the thyroid. Delphian node enlargement, thyroid isthmus tumor based on the position they're saying. Advanced laryngeal malignancy. It can be a malignancy of the larynx. Suprasternal dermoid or lymph node enlargement. So it can be so many of these things. So differentials, you'll have to write a lot of things. So guys, this thyroglossal cyst has one more differential, that is thyroid cyst. Okay. So whenever you feel there is a thyroid cyst, it can actually be a thyroglossal duct cyst. Okay. So when you aspirate its contents, if you're getting columnar cells, then it is a thyroglossal duct cyst. So that's what they're saying here. See this table here, thyroid cyst, you aspirate. If you're getting columnar cells and aspirate, it is thyroglossal duct cyst. Okay. TGDC. Okay. So that's what we are looking at in this video, right? TGDC. So now let's move on to the treatment. What do you say, people? So the treatment for this TGDC, thyroglossal duct cyst, is surgical excision. And how will you do surgical excision? Sistrunk operation. So this is what you have to write in the exam. It is called a Sistrunk operation. So here you will not only remove the cyst, you will remove the tract also. You will remove the body of the hyoid bone. You will remove some core of the tongue tissue also, which is around this tract in the suprahyoid tongue base, right, to the foramen cecum. So you will remove everything. So that is good. Otherwise, there will be recurrence. If you do simple excision of cyst without removing its tract, it will lead to recurrence. So what and all should you remove? You should remove the cyst along with the body of the hyoid bone, core of the tongue tissue, which is around the tract in the suprahyoid tongue base to the foramen cecum. This is the Sistrunk operation. This is the incision for Sistrunk procedure. This looks like some modified incision. Anyways, what are the muscles they are getting first? They are showing the sternothyroid muscle, which they have retracted, right? Is that the right word? They have retracted the sternothyroid muscle, and inside they are seeing this thyrohyoid muscle. Focus, guys, focus. Which are the two muscles? Sternothyroid muscle. ST. First of all, sternothyroid they got. Then they have opened it up. Inside they are seeing the thyrohyoid muscle. And what they are showing here is the TGDC, that is what? Thyroglossal duct cyst. Up you have the hyoid bone, right? So that's it about thyroglossal duct cyst. What is it? It's a TGDC. It's a unilateral. What is this unilateral? It's a midline. It's a midline neck mass. Okay. So basically, what is it? It is a midline cystic swelling, and it is rounded. It increases in size whenever there is infection. It can also have a draining sinus. it moves with trunk protrusion, remember. Okay, it moves with trunk protrusion. You saw how it is actually formed, because the thyroid anlage, it descends from this foramen cecum, passes through the hyoid bone in front of it, through it, etc., and it will reach this below it to form this thyroid gland, right? So this duct can be can remain, and this can develop a cyst later in life, right? So that's what you should understand. So basically, this is thyroid anlage, it descends, right? And this duct, whichever is left, that can have a cystic mass, that is a fluid filled it can have, right? So the cyst itself can have the thyroid gland also. You should be very careful. So a CT MRI next should be done to find the orthotopic thyroid gland, to find the normal position thyroid gland. Rarely this can go into carcinoma, rarely, okay? Then how will you do examination? We already told you CT MRI of neck. Then indirect laryngoscopy also, when you do, you can try to see any cystic swelling, right? Which can be the vesicular cyst, dermoid cyst, or the thyroglossal cyst. This will be fluid filled, right? What do you mean by cystic swelling? Fluid filled, that's what it means, right? So what are the differentials, guys? It can be lingual thyroid. So it can be, see, all the submental, all the midline neck swellings you should rule out. Submental lymph node, dermoid, Ludwig angina, thyroglossal duct cyst, aberrant thyroid, thyroid cyst. It can be Delphian node enlargement, thyroid isthmus tumor, advanced laryngeal malignancy, suprasternal dermoid, lymph node enlargement. All this you can write. So in thyroid cyst, what you will do, you will aspirate the content. If it comes as columnar cells, then you know that it is thyroglossal duct cyst. Otherwise, it can be a parathyroid cyst, papillary carcinoma with cystic change. Hemorrhage can be there in the colloidal nodule, simple thyroid cyst. So many differentials can be there. So look at this table where they have told you if it is brown fluid, what will it be? If it's bloody fluid, it will be carcinoma. If it is clear and colorless, it can be parathyroid cyst. If it is columnar cells, then you'll have thyroglossal cyst. So I think you have had overdose of differentials. Then treatment, surgical excision, Sistrunk operation. Don't forget, Sistrunk operation is the key word here. Sistrunk operation. So a simple excision of cyst, if you leave the tract behind waist, it will reoccur. So you will have to excise the cyst, including this tract of body of hyoid bone, core of tongue, etc. Right? So core of tongue tissue also they will remove. So this is the Sistrunk procedure. And here they have shown that when you first you will encounter the ST, sternothyroid muscle, then you will open it up and see the thyrohyoid muscle. Here they are showing you the TGDC, that is thyroglossal duct cyst, which they will remove. And here they are showing the hyoid bone. So what and all are the complaints of these people? Did they tell you the clinical complaints of these people? They didn't actually say what the problem they will face, but it will be cosmetically unappealing, right? So basically here, if you see, it can be unsightly appearance, it can be infected, then you will have to drain it, and it can also become a carcinoma later. So for these reasons only they are doing this thyroglossal duct cyst excision. Okay, so that's it, guys. We are done with thyroglossal duct cyst. Bye bye.